Hello and welcome everyone to Coach for Mind. We're extremely glad to be back with you after a long time, our beautiful, lovely audience, with another one of our episodes with Mr. Lekh Bajaj, who is an IIT Delhi graduate and a licensed clinical psychologist, and shares his little nuggets of enormous wisdom to help us create an epic lives for ourselves, which where he teaches us to observe and understand our emotions rather than to judge, resist, or react to them. Having said that, I would now like to welcome Mr. Lekh Bajaj to today's show.
Thank you, Duty. So we are doing this podcast sort of recording after a long time.
Yeah,
Yes, and let's see the topic what we have.
exactly. I'm excited about this. So, without taking much of your time, let me introduce today's topic to you, which is high functioning anxiety. Now, before this blows up your mind a little, I'll quickly dive into my first question to Sir. So, sir, can you please explain to us what is this term high functioning anxiety and is it any different from that normal anxiety that we know?
Hmm. Yes. So anxiety, when we say anxiety, we all, if you're a human being, you will feel anxious to some extent. So that's baseline anxiety is very common. And that is in a way functional also. For example, if I have an exam tomorrow, it is good that if I feel a bit anxious, otherwise I won't take any action.
Yeah.
So anxiety is some baseline anxiety is healthy. Now then the next part comes anxiety disorder, which where my life become dysfunctional because of my anxiety. For example, if I have social anxiety disorder, then my social life would be dysfunctional. I won't be able to talk to people or I won't be able to give a presentation. So that dysfunctionality is what we refer as disorder. Now, high functioning anxiety, when we say high functioning, it means that at the level of functioning, it is not becoming problematic. The person is still very much functioning in their personal, professional, or interpersonal life, but it is distressing. So these two parts are very important: dysfunction and distress. Both are present, then we call it a disorder. But in high functioning anxiety, dysfunction is not present. Distress is present. The person internally feel distressed about that particular situation or any. For example, if a person has social anxiety, they might not appear socially anxious. They'll be very well functioning. They might be giving presentations and everything. Internally, they would be distressed about it to an extent that it would bother them.
Okay.
So that's how high functioning anxiety is different, or rather, I would say it is a form of masking the disorder by more control or by being very proactive. But the anxiety disorder is there inside.
Okay. So, can you guide us through the signs, like particular symptoms of high functioning anxiety?
Yes, sure. So mostly the symptoms with respect to physical body, because physical body cannot hide anything. If you're feeling anxious, your body would show. You might bite your nails or you might start to sweat. But at the level of words, a person can hide. So physical symptoms are as much as similar. Sweating, tremors, or breathing pattern would change. All those, or heartbeat would increase. All those physical symptoms are as similar to an anxiety disorder. But at the level of behavior, the person would be very highly functional. Mostly people who have high functioning anxiety, they are mostly high achievers or people whose lives are very organized. They appear that this function is very sorted, but
Wow.
their sortedness is coming from excessive need for control. They have controlled everything so much because they are feeling very anxious inside. So that
So,
is
is
how it
OCD
is.
like a part of it?
No, OCD, because in OCD, person would be, the dysfunctionality would be very much there. A person might have obsessive compulsive personality, which can be similar to high functioning anxiety. But when we say obsessive compulsive disorder, because we are saying disorder, then their life would be dysfunction. For example, a person who is washing their hand 5 times in an hour, it is dysfunction. It is not a, like a very high functioning life.
Okay. So, like we always love to end our videos by knowing the solution of things. So, how can we address it? Someone having high functioning anxiety, how can that person address it and heal it in a step by step manner?
Yes, so I think first step is self-awareness, to realize that I feel anxious, although I am very much functional. And I think high functioning anxiety is even more common than the anxiety disorders, because even when we look at so-called successful people around us, some of them might have high functioning anxiety, because no one would look at them and say this person might be feeling very anxious inside, because their lives seem very controlled, because they have such a strong need for control, and they are very proactive about controlling situation. They are usually able to hide their symptoms of anxiety, and they get the result, and society mostly only cares about the result, not about the what the person is feeling. So
Yeah.
from that perspective, the person is appears very calm and composed and very to the point. But it's about a person need to ask themselves, am I feeling also in control, or am I feeling okay or comfortable? If the answer is no, that internally I know that I feel very anxious, and in fact some of the symptoms would include that the person would be constantly over analyzing everything. Now that
Okay.
processing is going on inside, that person knows it, not people around the person. So internally that over analysis is constantly going on, which makes the person to be distressed all the time. So it's not a sense of free or carefreeness is not.
Okay.
Something or the other is always going on. I'll do this, I'll do that. They'll be making so many lists, planning every step of everything. So
Okay.
which is what the distress comes, and that the person has to ask themselves. And as far as treatment is concerned, again, cognitive behavioral therapy is there, psychodynamic therapy is there. And if the distress level is too high, then medication can also be sought. But usually in high functioning anxiety, medication are not needed. Only counseling or therapy, psychotherapy would be enough.
Okay. So, is there something that they can do, be mindful of while they're living their lives? Maybe just gauge themselves if I'm feeling peaceful enough, and in the moment, anything that they can do.
I think mostly as far as self-help is concerned, relaxation exercises can be very much helpful for the person, because so far what is happening is they are not relaxed, they have excessive need for control, and they are controlling everything. They are always in action, making lists, planning everything, over analyzing everything. So if they can physically relax their system, then that need to control the external would reduce. So relaxation exercises can include breathing exercises, and another technique is called JPMR, Jacobson Progressive Muscle Relaxation, which can be easily found on YouTube as well. So practicing any kind of relaxation exercise, and usually people who are very anxious, we ask them to write down their thoughts, put their worries on paper. But these people are already doing that. So
Okay.
their main part is of relaxing the system, body and mind.
Okay. Wow. That was quite informative. Actually, many people don't know. They think I'm super productive and still I'm feeling the sense of always stress within me. So I think this will be very helpful for those people to at least take the first step to identify that these
Hmm.
things are happening with them.
Hmm. Absolutely.
Okay. Thank you, sir. This was an amazing, informative video with lots of clarity and simplification. Now, if you could relate to this video and if you could find yourself in the explanation that sir just gave us, do not hesitate to reach out to us, to Coach for Mind and our team for your mental health and that of your loved ones. And if you find value in this video, please hit the bell icon and do not forget to like this video, and please follow us on Instagram and LinkedIn for beautiful posts for uplifting your mental health and well-being. Thank you. Bye-bye.
Make sure you subscribe to our channel and press the bell icon so that whenever we come up with a new video, you are notified about it. Thank you.